Hi everybody, I'm here today to talk to you about medication adherence and how that is a health literacy issue at the urgent care I work with. The doctor that I work for always calls Decadron, also known as dexamethasone. With that, it is a steroid. It treats pretty much a lot of like inflammation and allergic reactions, maybe rashes, stuff like that. We usually give 8 milligrams, which comes out to 2 cc's worth of an injection, which goes in their buttocks area. When we go into the room, we usually have to talk to the patient and give them some information. So while we're in there, I decided that I think it's a good idea to give them useful information, and then instead of just trying to fill gaps with useless conversation. So my issue is the Decadron. It is pharmacies are always calling, patients are always calling, trying to get clarification on how they're taking the medicine, what the medicine is, how much medicine, and what the strength is. So instead of having to go look for the chart, because we're all paper in the facility that I work for, I know, old school, it takes a lot of time to be able to decipher what the doctor's writing and where their chart is. Sometimes it's misfiled. So to cut down on time management, which is another issue, two birds in one stone, we can start doing these handouts that I thought was a good idea. I did chapter 3. Now everyone in the clinic will have to be on the same plan, because if even one person is off, that doesn't make a difference when we're still trying to answer phone calls and patients' questions about something that could be taken care of by just vigilance and a little bit more time while the patient is actually here. So while we're in the room, we're going to give the patient one of these. Hand it to the patient so that it's distracting them from the needle in any ways. They can be reading the instructions, and if they have any questions, they can ask you there in the room. You can also say, you're going to be getting the Decadron today. You're getting it before 3, so you need to be taking 4 pills after dinner. Yes, 4. Now, a lot of people just with the 4 alone get confused because it's 4 pills. Explain to them they're little pills. So yes, 4 at one time. After 3 are different instructions, but still explain it to them while they're here in the clinic. So they're not calling back and saying, hey, they didn't explain it to me. Now, to stop the issue of the pharmacy, I came up with a plan to just staple one of these copies to the prescription so that the pharmacy has a legible copy of how the patient is to be taking the medicine and what the medicine is. Now these will be pretty cost effective because we're already in the office buying paper. We're going to use Microsoft Word to type it up, save the document onto our printer that we have, and just be able to print mass copies of these. Now hopefully that will be able to figure out the health literacy issue that we're having in our clinic of patients not understanding their medications, and if they're not understanding them, they're probably not taking them.